Hi everyone, my name's Arjun and I'm going to be taking you through the UCAT intensive pre-class work today. Now it's not very long because I know no one enjoys doing pre-class work, I don't either. And I'm going to try and keep it to about 5 to 10 minutes like I said in the email that was sent out to you guys. Now, basically what we're trying to do here is provide you a little bit of context around the UCAT so you can understand the exam a little bit better and therefore hopefully get more out of the intensive and be able to prepare for it better and get the kind of score you need. So really what we're going to explore today is what are aptitude tests and why are they used? Now you probably guessed from this that the UCAT exam is an aptitude exam, right? So we're going to try and understand what kind of exam it is, what happens during it, and why is it even used? So to start off with, what are aptitude tests? The first point I've included is that they're also called cognitive tests, because the first time I was learning about aptitude tests, I would search them up and some people would refer to them as cognitive tests and others wouldn't. And I spent a long time trying to figure out the difference between the two terms before eventually realizing that they're just the same thing. But now jumping into what aptitude tests are, they're designed to test your abilities and not just your knowledge across skill sets. So that's a little bit different to what you experience during year 12 or university, where you're often tested based on your knowledge, right? Now, you still require foundational knowledge to do well in aptitude tests, which is different to exams, kind of like IQ exams where you don't really need any foundational knowledge. So aptitude tests still require foundational knowledge, but there's a bit more to that. And they're also quite highly pressurized, often in time conditions to see how you can quickly react. And so they can test a whole bunch of different things on top of that foundational knowledge in a time pressured situation. That can include things like visual acuity or spatial recognition, your application skills, being able to apply the information that's been given to you, logic and reasoning, both in mathematical, verbal, or other contexts. And of course, there's the psychological stamina that comes with sitting an exam like the UCAT, which is really important to deciding your future career and how you progress through life from an, I guess, career perspective. And so as I've already touched on, these tests look at higher order skills on top of that foundational knowledge. And so the approach to study for them is quite different to school or university. It's not as transactional in the sense, okay, I'm going to study for 2 hours today and that will be enough because that's the amount I need to study to learn X concept or Y concept. Now, the UCAT specifically has 4 cognitive tests in it and 1 psychometric test. And a psychometric test sort of tests your psychosocial skills, how you would react in certain situations or how you should react in certain situations, right? So that's a lot of information that I've given to you. But if I had to summarize aptitude tests in 3 dot points, it would be they have a basic level of foundational knowledge that is tested. They often test higher order skills on top of that, including logic, reasoning, verbal, spatial, and it's often in a time pressured environment. So if you can remember those 3 things about aptitude tests, then you have a strong understanding of what they are and what you should be thinking about when it comes to the UCAT. So what are the things they're going to test you on? Now, you might be thinking, all right, well, that's all good, but why do I even have to sit this UCAT exam? Like, why do we even have an aptitude test? What's the point? So the point of using aptitude tests, simply put, is because they're designed to be a better indicator of choosing good medical students than ATAR or GPA. Now, I'm not trying to discredit ATAR or GPA, right? Because getting good academic results is an important component of being a medical student, but it's not the only component. So now that I'm at the other end of my medical training where, I've experienced a lot of clinical placement, I've come to fully appreciate that there's a lot more it takes to be a good medical student and a good doctor than just being smart. And so the reason the UCAT was introduced is because there's a lot of study and research to show that it is a good predictor of someone who would be a good medical student and a good doctor in the future. They're also designed to be fairer than high school and university education. So often in, high school education or university education, perhaps being from an Anglo-Saxon background or going to certain types of schools or getting some type of, teaching style might give you a clearer edge. Whereas the UCAT has some higher order skills, but with more foundational knowledge, which means it's accessible to more people, right? And so what you can see here are the levels of higher order skills that are tested in any sort of exam. So when you focus on school, most exams focus on your knowledge. And if it's a really good exam, it might focus on application and, a bit of comprehension. And so schools tend to stick around this area. Universities tend to stick around this area. Whereas the UCAT kind of takes this whole bubble and explores the analysis, the synthesis, the evaluation, these really high order skills, and tests your ability to apply those, again, in a time-pressured condition. So now we've looked at what are aptitude tests, why are they used? Now let's delve a little bit more into the UCAT for this, right? So most of the knowledge that's tested in the UCAT actually matches to a year 10 level or less when it comes to the foundational knowledge bit. So as I told you guys earlier, there's 5 components, right? So the first cognitive component, verbal reasoning, has a reading level similar to year 9-10 reading levels. Decision making, which is the second component, has both reading comprehension and maths involved in it, which is similar to about a year 9 level. Quantitative reasoning, which is the maths section of the UCAT, is similar to year 10. And abstract recognition is pattern recognition. Sorry, abstract reasoning is pattern recognition, which, arguably people even in primary school can do. And then there is the psychometric test, which tests your psychosocial skills, which is the situational judgment test. So you might be thinking, are you telling me that the exam which decides pre-medical and pre-dentistry students and, decides where they fit on the spectrum is designed at such an easy level? Well, yes, in terms of foundational knowledge, it is. Yet the exam is used to separate a cohort that is generally quite high performing. And so how does it do that? It's because of the levels 2 and 3 that we were talking about, the fact that it tests higher order skills and it does it in a time pressured way. So what's really, really important, and the one thing I want you to come into the UCAT intensive with, is that it's not just knowledge based. There is a lot more to the UCAT, and I would like you guys to appreciate that. Now, just to give you a quick example, the abstract reasoning section, which is the pattern recognition section, on average, you get 14, that's 14 seconds per question when you're sitting the abstract reasoning component. Decision making, which gives you the most time out of any section, gives you 65 seconds. Verbal reasoning and quantitative give you 29 and 40 seconds respectively, and situational judgment gives you 29 seconds per question. So it's a very quick exam, but it's not just quick. Like I said, there is also higher order skills on it. So like I said, it is highly time pressured, tests logical, spatial, and verbal comprehension skills, often includes common pitfalls that students will fall for, and plays on your biases. And so what we're going to start off in the UCAT intensive is we're really going to explore how you can avoid falling into these pitfalls. So what we're going to aim to do on the day, essentially, is show you a few warm-up questions and get you really used to, what the UCAT looks like, what each section sort of looks like, then go into a UCAT deep dive 101, explore what is it, when is it, where is it, why does it exist, which you guys have already touched on a bit here. From that, we'll actually go into each individual section, explore it a bit more, tell you guys about the foundational knowledge that's there and the skills that are assessed in it. And then right at the end, we're actually going to provide you some extra resources which you can use to sort of get started in preparation. So I'm really looking forward to having you guys there. I'm going to be there. And as you will realize during this presentation, and definitely in the UCAT intensive, I'm really, really passionate about medical education, from the pre-medical all the way to becoming that senior consultant who's treating patients and doing all the cool things that they get to do. Really looking forward to seeing you guys. Thank you so much. Glad you stuck around till the end. Bye.